Tell me about mindfulness-based cognitive therapy, the MBCT pilot that you ran in North Wales.
We chose to run a standard MBCT 8-week course. We wanted to widen it out slightly from just depressive relapse, so we were really inviting GPs to refer people with history of depression, anxiety, and other things really. So to some extent it was a feasibility study to see who came and what was possible really. So we did some promotion to local GPs, we invited them to refer in, and then there was an assessment process which I undertook as the teacher. So I saw everybody individually and did some assessment. And then out of 31 patients who were referred, who came for assessment, 17 were selected and 17 went forward. And then Gareth and I taught the 8-week course together, so that was 2 hours once a week. Patients came from a reasonable geographical distance. We only had one dropout out of the whole course. And then the results show that actually it made a significant difference to the group that we worked with. So that's what we did. And then the other aspect that we were really looking at was to survey GPs and find out from them some of their attitudes. Were they interested in this? Did they think it was a good idea? What would encourage them to refer? What did they see as the potential difficulties? Those kinds of things.
Can you tell me in a bit more detail what you learned from the pilot?
I think I suppose one of the things that stands out for me was the referral process. Naturally enough, a lot of GPs referring into the scheme didn't really know very much about it, and that's something we would hope to improve. And that so the assessment process was actually quite time-consuming. So that would be something I think we'd need to do some more education and some more training of people so that the assessment process wasn't quite so long drawn out. We learnt that patients like it. They turned up. Only one of them dropped out. They really gelled as a group. We all went out for a meal on the last day, which was at their instigation, and I know that some of them are attending follow-up groups that we're offering in Bangor. Logistically, we learnt that it's possible to, in terms of the administration, it worked fine. I don't know what else.
I was, yes, and I mean, I'd merely add to that or reinforce the fact that I was a bit concerned. This was being given free to those who, there was no cost involved. I thought maybe we'd have a significant dropout rate, but actually we were surprised that just the one person dropped out. So it just goes to show that if the selection process is thorough and proper, then the dropout rate is not a problem.
Within the NHS, where would mindfulness-based cognitive therapy be best placed?
The American experience where this first started is that they provide it in a secondary healthcare setting. But I think with the structure of our NHS, I've no doubt myself that it is in the primary healthcare sector that mindfulness is best placed. It's proven to work for chronic, repetitive psychological conditions, such as chronic repetitive depression, general anxiety disorder, chronic panic attacks, chronic fatigue, that broad spectrum of psychological illness that we invariably see a lot of, unfortunately, these days in primary care. So we found, and I think this pilot has established in our mind, certainly, and confirmed in our minds, that a primary care setting would be the most appropriate place for it, without doubt.
What would the benefit be of having mindfulness-based cognitive therapy available through primary care?
I think we know that it has a good effect on depression, and we also know from research that there's many other applications. So in terms of primary care, there's an obvious application for generic classes. You can have mixed groups. That makes it quite cost effective as well. I think in terms of being person-centred and really giving patients the tools to manage their own care, there's a huge advantage in the mindfulness approach for that as well.
Anything you'd like to add, Gareth?
Well, other than to say that I think that there is certainly the potential for Wales to be at the forefront of healthcare, mental health care provision. Certainly with our proximity, as I work for Betsy Cadwallader University Health Board, then to associate with an excellent academic unit which has a long and well-established tradition in teaching mindfulness, then the potential is there. We quite honestly feel we have a potential professional obligation, if not a moral one, really, to bring the patients that we have in primary care towards mindfulness practice as taught and now proven to be effective.
What do you think is the perception among GPs in relation to this area of care?
Well, increasingly, I think they're accepting that mindfulness is here to stay. If we roll the clock back 5, 6, 7 years, well, what's that? But now, increasingly around our locality and our proximity to Bangor, where there is a lot of mindfulness studies going on, we accept that it is a practice. I don't think that we as GPs necessarily will be the primary providers of this, but certainly I think we could well be the primary referrers to either primary healthcare counsellors or an academic unit like Bangor University for referring patients for therapy.
And how do you think access to MBCT might be widened?
There's two possible models. One is that people who are already trained and very experienced, like us at Bangor, might offer a service that could be kind of bought in by local health boards or by GP surgeries. Another way would be that we train people who are already within the service, for example, mental health workers or GP counsellors. So that's two possible models. I think either way, there's inevitably a cost implication.
Gareth, what are your thoughts on widening access?
It does take a while to train to become a mindfulness teacher, and therefore I think that we would have to be quite dependent upon the academic unit, certainly in the initial stages, and it would take some time to train primary healthcare clinicians, possibly primary healthcare counsellors, to take on this role in some way. But certainly in terms of sustainability, if this is going to be something that we want to really have a significant long-term impact on the mental health well-being of our communities, then I think sustainability would be best achieved by getting into the NHS staff and teach from there out towards patients.
Eluned, anything you'd like to add to that?
I think that it would stand the best chance myself if we were able to train people who were then within their own locality, within their own GP surgeries, were able to offer this, or perhaps one person within a region or something like that. But I think it's the initial training that's really the thing that we need to look at first off.
Do you have information in terms of costs and benefits? Do you have a sense yet of how cost effective this might be?
Mindfulness is kind of a bit of a mindfulness explosion really in the UK at the moment, and lots of aspects of it are being researched, but we haven't really started on the health economics of it, except to say that intuitively, if we're teaching as a group and we've got the kind of benefits that we've just noticed with the group that we've just taught, then common sense tells us that it's cost effective, but we don't have that evidence as such yet.
What do you think would be the benefit of having mindfulness-based cognitive therapy available through primary care in Wales?
Now, the way I see it is that that there is this tremendous potential here, potential for Wales, or certainly for North Wales and in the locality of Bangor, to establish mindfulness as a therapy, particularly for the prevention of depression, for which now there is very hard evidence that it helps and works. in primary healthcare, we have that broad spectrum of psychological conditions that would be would benefit from mindfulness cognitive therapy, and if we could think this through properly, I'm quite sure that we could develop a template that would be could be replicated in Wales and perhaps throughout the UK. Maybe we'll see.